I'm Mercy Manjala. I'm the AfriWon president. That's the Young Doctors Movement for WONCA Africa. And we're here doing our pre-conference. So we started off with field visits to a primary care network called the Makadara Primary Care Network, which is one of the first primary care networks established in Nairobi County. So we had a team of international delegates go through a presentation detailing how the primary care network was established, the process, everything they have done so far, and also some of their challenges.
We were able to see how primary health care as well as the community health strategy is being put to work. And it's a new strategy that's actually being implemented across the country. I've visited several counties and I've seen it come to place.
So in terms of the primary care networks, we are doing the hub and spoke model. So we have the hub, which is a level 4 facility where we are seated right now. And then next to the lower level will be the spokes, which are the level 2s and 3s, meaning the health centers and the dispensaries. Then at level 1, we have the community, where they're led within their community health units.
I felt lucky to really get to know and meet with several community health workers representing primary health care and representing communities and serving communities in the Makadara neighborhood.
I was shocked. Basically, I was shocked because the economical capacity of the country to respond to the demands of the health problems of the population is poor, is really difficult, the situation. And still, in spite of that, these people managed to organize a huge and really well-working system of the community help.
So for Nairobi County, we have 17 sub-counties, as I've mentioned, and we have a population of about 5 million. In terms of community health units, we have about 748, and we've said each unit has 10 community health promoters. So we have 7,480 community health promoters and 119 health facilities.
These workers are volunteers. Are they community workers with some kind of salary for what the work they are performing? They are volunteers.
They just get a stipend.
That is
just volunteer.
Yes. Right? Per month?
Yes.
I was shocked by the quantity of the volunteers working for this system, and some of them are working 100% time for free. And I've seen that all the people who were engaged in this work were really enthusiastic. I was amazed by the happiness in their faces and how much they love. Meanwhile, they are performing such a complicated and responsible work.
So how we are supplementing their skills is through the MDT.
Yeah.
MDT now is scooping all the way to the community together. So the things they are not aware of, we have technical team that know how to handle clients, know how to do the measurements correctly, and then so that we have integrated that.
Yes.
And then you weigh your baby.
Yes.
You have to be able to lift the 25 kilo. Your shoulder will not do good. Up here.
Everyone was able to appreciate the hub and spoke model that Kenya is establishing to strengthen its primary healthcare systems. And they're also able to appreciate some of the challenges we are having. And more so, I think, on my side is appreciating the role that the community health workers have been playing to ensure that, especially communities that have low to no income, access primary care services.
It'll be amazing if at some point you end up with funding that is for a living wage for each one of them.
Yes.
As we see it in the U.S., the state where I am in North Carolina did a really good job during the pandemic. There was funding for 800 community health workers, and it was a living wage, so they didn't have to do something else. They were able to do this full time. But then the pandemic ends, the bottom falls. And so now we're trying to find a little grant here to do this work, a little grant there to do this work, but it's not the same. It's such important work you guys do.
Very important.
So important and so close to the community.
So after our visit at the hub, we were able to join the community health workers to do a household visit for one of their patients who are under their home-based care program. Together with the multidisciplinary team, we were able to appreciate what they had done for this patient, who was a hypertensive patient with stroke.
She fell down. I was called. I went there. I found her. She's down. I took her a camp. We went to the facility at Jericho. When we went there, we found the pressure was too high. That's why she fell down. And then they tried to stabilize the pressure, and then they referred to Makadara Health Center.
Makadara, I'm the medical officer, so I'm the one who saw her. Her blood pressure had gone down to around maybe 160, 90, but she needed an urgent CT scan.
We went for CT scan. She was told she's out of danger, and then she goes in the house. I visit her there. I check how she's going. I take the BP pressure. And when I take the BP, if it's high, I make a call to the doctor. She comes and visit her, that she can put her on medication.
Currently, she's doing well. She's able to walk. She can talk, and her blood pressure is controlled. And she's still continuing with her physiotherapy.
What I realized during that visit is that as I was seeing the similarities between the community health workers in Africa and the community health workers in North Carolina that I have been working with for many years, I realized how much they stretch the limits of health systems and hospitals, really bringing the information about health and treatment and knowledge about illnesses in care and prevention into the community, and also bringing it back from the community into the health system. It was really beautiful to see the parallels, the similarities, and when we're speaking about primary health care, it's like we're all speaking the same language. It was just a special moment for me to recognize the real core, the real love that happens in these settings.
After that, we were able to visit the Spoke. The Spoke is Jericho Health Center. And at Jericho Health Center, we were also able to appreciate the team of community health workers who welcomed us at the gate at their community health desk and explained to us what they do at the community health desk, how they handle referrals, and how they handle registration of patients, and also follow-up.
The time we started having community health promoters, our health system changed because we are able to link them to the facility. Remember, not all the community can be able to pay for a family doctor or go to a private facility. So they usually prefer to come to government facilities. And when we attend and give them the referrals, we usually make them happy because they realize they are well attended compared to private hospitals.
Okay, and there's also a challenge. We have not been fully trained on the kids, so there's a challenge within the CHPs.
I really liked listening to the CHPs. I see gifts in training CHPs, and I'll advocate for that if I get a platform anywhere. Because we already have them, they already have the kids. But I think there's a huge gap in knowledge, which can be a point of improvement, especially if we are to strengthen the health systems in the country.
If I can say about the stipend, let me ask you, like now if you're given a stipend of 3,500, what can it do to you? You have a family, you have children to take to school, you have also another family like your parents to take care of, you have also the house rent, and what of you? Is it really enough? So at least we need something which is better, which can at least sustain us, so we can do our work well. Because sometimes when you go to even to see the patients at the household level, they think you are well paid. You are well paid to do that job, but that is a peanut. Because 3-5 you just teach 1 or 2 days. That is just for fun. So being a CHP, it is out of passion. You are not just doing it because of the money. It is a calling. Yeah, and we do it passionately. Yes, that is what you do. Yes.